with Shai Gazani. He's CEO of NeuroMetrix. And they came up, we reported about their devices many times in the past, and now they have new announcements and new device technologies, and so Shai is going to tell us more about what's going on, the latest with NeuroMetrix.
Well, thank you, Michael. Appreciate the opportunity to talk again. So at CES this year, we're really introducing our latest technology, which is the second generation version of Quell, and some very important enhancements of that second generation. So that second generation device is called Quell 2.0, and that was launched in September, October of this year, so just a few months ago. And I'll just show you that device. And for those who are familiar with Quell, this is about half the size of the original device, but with in fact, more electrical power and similar battery life. So it's a really significant innovation, because one of the most important things we learned from our customers was that as a body-worn device, the size of the device was very important. So we invested a tremendous amount of energy in reducing the form factor by 50% to make it much more comfortable when you're wearing it during the day, as well as while sleeping, which is a very important use of the product. So that was launched in September, and then here at CES, we're really talking about two additional innovations that we're unveiling and will becoming commercial quite soon. And the first is AI enhancements to the Quell device. What that means is we've applied machine learning to a very large database that we have. We believe we have the largest chronic pain database in the world.
How many?
70,000 of our patients, 70,000 people using Quell are contributing data via the device, which records objective measures of sleep and activity and gait, as well as they provide their clinical information, their pain levels, all via the app that works with Quell. So this database is incredibly rich. Hundreds or thousands of data points on each one of these patients, including outcome measures. So we are able to look at how various kinds of use patterns, clinical characteristics predict clinical outcomes, and then deliver that information back to the user to optimize their experience. So the first thing we're launching is a smart calibration. And what that means is when you first get the device, it has to determine the right intensity for you, essentially your dose. That is a very kind of subjective experience. Now with AI techniques, we're able to actually accurately predict that right out of the gate. So it means you get your optimal dose immediately upon opening the box, versus having to go through a kind of a trial and error process. The second thing we're introducing here is what we call Therapy Coach. And why this is important is because chronic pain is something that develops over years or decades. It's not going to be corrected overnight. So users of Quell, they have to be patient with the process. It could take weeks and maybe even up to a month to begin to experience the benefits. And for a lot of patients, that's much like taking an antidepressant or some other kind of medication. If they don't experience that immediate feedback, they may lose the incentive to continue.
They may lose hope initially, but until they see clinical results.
Exactly, and so what we've done is we've gamified the first 30 to 60 days, which is over the period over which you will experience pain relief. So by giving them alternative metrics and other outcomes and other indicators over that period of time, it gets them through that first 30 to 60 days. And we think that's going to get them to the best outcomes and ultimately to long-term use. So Therapy Coach and AI is really what we're layering on top of the recently introduced second generation Quell.
So how does it work? Do you have to go through a new FDA approval process, or it's just kind of grandfathered in?
Yeah, that's a great question. The core stimulation and core therapeutic benefit hasn't changed. So really layering on benefits around that. So those do not require new 510Ks in this case. You have to always, when you release a new version of a medical device, you have to go through a process of evaluating whether a new 510K is required. In this case, we would not believe it was required.
And how sales are going? I saw advertisements on TV, and there, seems like you increased your base where you sell your devices.
Well, we hope that advertisements lead to sales, but we're getting good traction. We're really focused on building awareness of a Quell as a brand for chronic pain. We're a small company. We're not one of the large pharma companies that has a pre-established brand. So it's a process. But we've probably at this point sold about 200,000 devices since launch. We launched the Quell technology at CES 2015. So we're in our 4th year now. And we're encouraged by what we're seeing, but there's a lot of work to do. We're doing a lot of clinical work. We're trying to get physicians to better understand the technology so they can potentially recommend it to their patients and continue to do the advertising and promotion.
I see a lot of companies moving to subscription model. It seems sometimes that subscription model actually encourages people to stick around because are any plans to move to that?
Well, we offer so as you know, the model here is a device and then electrodes, which you need to change once every 1 to several months, depending on your use level. We do offer subscriptions for the electrodes, so you can sign up for a subscription and you'll actually get a reduced price and automatic shipment. So we do offer that, but we are not necessarily contemplating combining the entire product into a subscription service because I think the diversity of use is so great. It represents the diversity of chronic pain. So it's hard to develop efficient subscription models to satisfy every different type of user.
I meant more like data processing or application or that kind of
I
stuff.
see. Yeah. So as far as our customers are concerned, everything we do in terms of AI, data management, storing their data, providing them with insights, it's all without cost. And we really view that as encouraging them to use this technology to hopefully get good clinical outcomes.
All right, thank you very much. Good luck to you.
Thank you very much.